while we all find a deep sense of meaning in our work, I think that it's important to just carry that over into your life in general and just make sure that you're not losing balance. And ultimately, I think that will just make you a more productive physician and also just happier.
That's Dr. Julie Croley, and this is Dermatology Weekly, the weekly podcast from MD Edge Dermatology. I'm MD Edge editor Elisabeth Mechcatie.
And I'm MD Edge editor Terry Rudd. Today, dermatology residents may be among the least burned out residents across specialties, but burnout syndrome still affects almost 1 in 3 dermatology residents. In this special resident takeover of the podcast, 3 dermatology residents, Dr. Judy Croley, Dr. Elisabeth Tracey, and Dr. Daniel Mazori, discuss sources of stress for dermatology residents, as well as tools to identify and combat burnout.
In the news, why adherence to topical treatments for pediatric atopic dermatitis is low. Intradermal autologous platelet-rich plasma may boost hair density, and your electronic health record will likely continue to have trouble sharing with other health IT systems.
You can reach Dermatology Weekly by emailing us at podcasts@mdedge.com. You'll also find that email address in the podcast description.
And now the news.
A new study sheds some light on why adherence to topical treatments is low among parents and other caregivers of children with atopic dermatitis. Researchers at the University of Illinois Chicago surveyed members of the social media group Global Parents for Eczema Research, an international coalition of parents of children with atopic dermatitis. They asked about medication adherence and reasons for changing treatments. 86 parents completed the survey. The mean age of their children was 6 years. More than 80% had moderate or severe eczema, and about half lived in the United States. 55% of the parents said they used the medications as instructed by their doctor. About 2% said they used more medication than prescribed. But 30% said they used less medication than directed. And almost 13% said they'd stopped using the medications. Side effects or concerns about side effects were the most common reason for non-adherence, cited by 46% of parents who didn't use the treatments as directed. Symptom resolution was the next most common reason for non-adherence, reported by 28% of parents. 23% said the treatment wasn't helping, and 18% said they didn't trust their doctor or agree with their recommendations. What would have made parents more likely to follow medication instructions? 56% said a clearer indication of effectiveness would have helped. 14% said having access to research or evidence about benefits and side effects would also have helped them remain compliant. A good relationship between the physician and patient was associated with taking medication as directed. The researchers say education could help improve medication adherence. Clinicians can help close the gap by taking the time to explain treatment's risks and benefits, thus helping ease parents' concerns. The results appear in the journal Pediatric Dermatology.
Intradermal injections of autologous platelet-rich plasma, or PRP, topped placebo at increasing hair density in men and women with androgenetic alopecia. That's according to a meta-analysis of 7 studies from the United States and several other countries, conducted by researchers at University Hospital Cologne in Germany. PRP contains cytokines and growth factors believed to play a role in new hair growth. PRP is used off-label for this use in the United States and Europe, but clinical evidence of its efficacy is limited. Of the 7 studies in the meta-analysis, 5 reported statistically significant increases in hair density in favor of PRP over placebo. The remaining 2 found no significant treatment effect. In the 7 studies, the pooled mean difference in increasing hair density between treatment and placebo was 30, but the 95% confidence interval ranged from 1.8 to 59. None of the studies identified any significant short-term treatment-related adverse effects, but the authors suggested that future studies look at potential long-term adverse effects of treatment, and that PRP be studied further in randomized controlled studies. The findings appear in the Journal of Cosmetic Dermatology.
What will it take to push interoperability of electronic health records and other health IT systems forward? A new survey by the Center for Connected Medicine finds that senior leadership at medical practices isn't fully committed to the push, and the financial justification for such an effort remains a concern. The fact that interoperability continues to be an elusive target, despite being a regulatory emphasis for more than a decade now, comes as no surprise. Dr. Robert Bart is Chief Medical Information Officer of the Health Services Division at the University of Pittsburgh Medical Center. He says interoperability certainly helps healthcare overall in the U.S., but whether it contributes directly to the financial bottom line of a specific organization might vary significantly. Dr. Bart says financial incentives won't be what gets EHRs and other health IT into a more interoperable space. Instead, the Fed's push to bring ownership of health data to the individual patient will be a key factor. He says there's a second factor as well, and it's going to take a lot more involvement from government to achieve: establishing a clearer definition of health IT standards. We'll be right back after this message. And now, Dr. Judy Croley, Dr. Elisabeth Tracey, and Dr. Daniel Mazori.
Dermatologist Dr. Jeffrey Bonabio once said, "The phrase dermatologist burnout may seem as oxymoronic as jumbo shrimp, yet both are real." Burnout is a syndrome of emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. Burnout among dermatology residents warrants awareness, as it does in other medical specialties. Although dermatology residents have been shown as amongst the least burned out residents across specialties, the burnout syndrome still afflicts almost 1 in 3 dermatology residents. So I think awareness of this notable burnout prevalence is important and may ultimately facilitate identification. Hi, my name is Dr. Julie Croley, a third-year dermatology resident from the University of Texas Medical Branch in Galveston, Texas, and I am joined by my fellow Cutis resident corner columnists, Dr. Dan Mazori and Dr. Libby Tracey, for this resident takeover episode on dermatology resident burnout. Do you guys want to introduce yourselves?
Hi, I'm Dr. Libby Tracey. I'm from the Cleveland Clinic, and I'm also a third-year dermatology resident.
Hey, everyone. I'm Dan Mazori. I'm a third-year resident as well in Brooklyn, New York at Downstate.
Great. Welcome, guys. What unique challenges do you guys think dermatology residents face over other specialties?
So I think one of the challenges that comes to mind happens even before we start dermatology residency, and that has to do with our internship. So I did a traditional prelim year. Mine was in New York City, and I remember being more stressed and tired during this year and right after than I have been ever in dermatology residency. I was drawing my own blood, doing my own EKGs, really doing a lot of work on the front lines like that. So I think that, coming into residency with that in the background is one of the unique challenges that we face as dermatology residents and other residents who similarly have to do an internship also experience.
I agree. I also did a prelim year, and mine might not have been quite as grueling as that, but I think that another aspect of doing an intern year before a residency, the traditional dermatology part of the residency is that you have 2 years of being the least experienced person in your department, and so I think that adds to the stress and the sense of the lack of accomplishment during that time.
Yeah, for me it's quantity. I think, the quantity of patients, the quantity of notes, the quantity of callbacks, it can make the pace overwhelming at times. I think other medical specialties tend to be a little bit slower paced, and that's not all specialties, but I find the just sheer quantity of what we have to do in one day to be a stressor as well.
Yeah, I think quantity is a huge theme. We wear a lot of hats as dermatology residents. We have to learn a lot of different things, from med derm to peds, inpatient, dermoscopy, surgery, derm path, cosmetics, and all of that I think speaks to the steep learning curve that exists throughout dermatology residency, but especially in the first year, because most of derm isn't covered in medical school. And so, doing dermatology residency is almost like doing med school all over again, where we're learning things for the first time and memorizing things and reading things that we've never heard before. So that can certainly add a lot of stress and pressure.
I think compared to other specialties, it seems like from my experience knowing residents in other fields in medicine, it seems like we put more emphasis on our board exams. And there was a Canadian study that surveyed residents, and residents cited examinations as their top stressor. And I think that that's somewhat unique to dermatology.
In reference to board exams, I think another stressful factor for dermatology residents is the fact that the board exam is changing. I think it makes some of the dermatology residents stress about changing their studying strategy, thinking about what sort of content is going to be on the new test. I think that can be a source of stress for residents. Well, we know dermatology residents have reasons to be stressed out. Has y'all's institution done anything to help residents prevent burnout?
So we attend various lectures on burnout. Our institution has them during orientation at the beginning of each year. And then as a department, we also have different lectures sprinkled throughout the year on subjects like burnout. We also have different types of events that we throw as a department. We have a barbecue in the beginning of the year to welcome our new residents, and all residents are invited to that. And this past year, our chairman made a special visit to the barbecue as well. We have a holiday party, and last year we had a free breakfast on one of our academic days as part of resident appreciation.
My department also puts on wellness events. We have lunchtime wellness events. We've gone to yoga. We have parties. I think that helps build morale. But I think maybe more importantly, we have town halls and other forums for residents and other members of the department to air their grievances and then come up with concrete action steps to make changes to improve our, the quality of life at work. And over just the past few years of my residency, I've already seen really great changes happen. So I think that helps to build morale and to help avoid burnout when we know that we can make positive changes in our day-to-day work. Some quick examples: we had an improvement made to the prior authorization process, and that's, a big source of stress for everyone in dermatology and probably all of medicine, prior authorization. So kind of making that more streamlined was really helpful for us. Another one was improving the way that we cover other residents and attendings who are out on vacation, things like that were just day-to-day stressful and inefficient, and improving those workflows just, really helped us.
I agree. Something that happened at my residency program this past year that started at the resident level was that we changed the dress code for the residents who are on the inpatient consult rotation. So instead of having to wear business casual, those residents can wear scrubs. And that's something that residents wanted for a while, and we were able to implement that. And it's made a big difference in quality of life. So, Libby, I agree, having ground level initiatives like that make it all the way to the top are really important.
One plan of action our institution has implemented that I think really helps prevent resident burnout is we instituted something called a positivity box in our department. The positivity box is exclusively for positive comments. Residents and faculty are able to put anonymous comments in the box throughout the week. And then every Friday morning during our academics, we read out all the comments to the entire department. And I think that's done a lot to promote resident wellness and prevent burnout, because I think often as residents, we feel like we're doing a lot and we don't always get positive feedback, or sometimes we feel like the hard work that we're putting in doesn't really get noticed. So I think the box is just a great idea to help not only people feel like their hard work is being noticed, but just kind of create a sense of positivity within the department. Often there will be funny comments in there, silly things, but some very serious too, we had a first year help out at our volunteer clinic for indigent patients when he wasn't scheduled to. So just kind of acknowledging him in that positivity box.
I think that's a great idea, and I think the idea of formalizing compliments and feedback in general, I think, is really important. So whether it's done through a positive comment box like that, or at my program, we have an open door policy with our program leadership, and we meet with our program director 2 times a year, and we also have a formal mentorship program. So basically just, formal structured procedures that allow for feedback. I think it's very important, Julie, like you were saying, so that people get recognized for what they do and what they do well.
So what tactics do you guys personally use to de-stress and stay focused?
For me, it starts with the basics, getting a full night's sleep every night, the occasional junk and comfort food, watching TV, listening to music, spending time with my friends and my family. Those are the things that I try to do as often as possible.
I agree. It's kind of cliche, but I think it's all about balance and about creating time for those other things that are important to you and not feeling guilty about setting aside time to do those things. We don't always need to be productive and always be working, as much as we may feel that way.
Yeah, agreed. I think that balance can really promote a healthy lifestyle and also just help us care for our patients better. I think it also sounds cliche, but a happy doctor makes a happy patient. I think when you are able to have balance in your own life, you're able to really care for other people and just ultimately makes you a better provider.
And then in terms of staying focused, something that I try to do also is just sort of maintain my sense of mission, the fact that I'm grateful to be a dermatology resident, that we're on the path to being dermatologists, keeping in mind and trying to remember the light at the end of the tunnel, I think helps, reinvigorate me and reset me if I'm having a long day or if I'm tired after a crazy day. So I try to be mindful about that.
I think that it is important to have that and insight, but also to take things a step at a time. I think often work can seem overwhelming because there's such a large pile of work to do every day, so many things on your to-do list. One thing I find very helpful every week is I just make a list of what are the important things I need to do this week, what are my important goals, and that kind of helps me stay focused, at least throughout the week. And then if I can't get through my to-do list every single day, as long as I'm keeping those goals in mind, it makes me feel a little bit less stressed that although I didn't get everything done, I'm still working toward these goals that I have set out for myself. So I think that's helpful.
I agree. That's really important. I think that as dermatology residents, most of us, if not all of us, are type A people. And something that I joke about now, but I sort of also mean seriously, is that I try to be more of a type A- kind of person. So, just knowing that it's okay to be good enough, even though we're trying our best and trying to be great. And, forgive ourselves if we don't finish everything that we're trying to do in a given day, and know that we always have tomorrow or the rest of the week to get things done.
Yeah, like that A-. Sort of along the same lines, what advice do you have for first-year residents?
I think it's important to try to come into residency with the goal of creating a positive culture. I think that in medicine, in our work environments, we can often get into patterns of complaining and always sharing with our co-residents, the hard parts of our day and the annoyances that we had to deal with, how many minutes we had to spend on the phone waiting for a prior authorization. But I think creating a more positive culture where you share the positive things, kind of like your comment box, but just doing that day to day, like sharing cool cases, talking about interesting things that you learned can, just create a better environment for everyone.
I think it's also maybe important to set some expectations for what the first year of dermatology residency is going to be like. I think on one hand, everyone should take like a huge sigh of relief that they've made it. They're finally in the residency that they worked so hard to get to. And there's like a huge sense of accomplishment that should come with that. But I also think that on the flip side, it's a tough year, like we were saying before. There's a steep learning curve. And so it's still stressful. you may not be working the same night shifts that you were doing as an intern or in medical school, but you're still replacing that stress with other stresses like studying a lot, maybe more than you studied as an intern, even as a medical student. So I think that if you have that sense of expectation, then you can be prepared for it rather than be kind of blindsided. And if you're prepared, maybe you can, have strategies at the ready to prevent any issues from happening.
Yeah, those are great pieces of advice. I think my advice for first-year residents would be, and we kind of touched on this before, but just to find balance. Carve out time for you, pay attention to sleep, nutrition, exercise, social support. All these things are very important. And while we all find a deep sense of meaning in our work, I think that it's important to just carry that over into your life in general and just make sure that you're not losing balance. And ultimately, I think that will just make you a more productive physician and also just happier.
I agree. And I think, balance is an interesting word, and it's, a lot of people talk about it across specialties, across fields, beyond medicine, just sort of in the world at large. And I think that, when you hear the word balance, some people roll their eyes because they think it's unattainable. But I think that balance doesn't necessarily mean having a balanced day. You can have a crazy day, but a balanced week. Or maybe it's a crazy week, but a balanced month. So I think that there's a lot of ways to interpret balance and try to seek balance. And it may not be a day-to-day thing, but it can be sort of a more overall experience to try to achieve.
I agree with that. I think as residents, we don't always have the opportunity, even within dermatology, to find balance within a day. Sometimes you may have to stay late after work because a patient needs you, or you may have to study for an in-service exam after hours. So you're not necessarily going to be able to achieve balance in every single day. But I think to take a step back and try to achieve overall balance when you look at it more on a macro scale is more obtainable.
And then along those lines, if, someone feels like they're slipping, I think that trying to address things as soon as possible is important. So, having someone that you can turn to, whether it's, a friend or a loved one outside of residency or a colleague within your residency program, your chief residence, your program director, your chairperson, anyone that you can feel like you can speak to, even outside your department, someone in the GME office, whoever it may be, to try to sort of nip issues in the bud before they grow into bigger ones.
Absolutely. What challenges exist in recognizing burnout amongst dermatology residents?
I think the perception of, the derm life that, it's really kind of cush lifestyle and we're all happy all the time. I think that might create somewhat of a stigma for admitting we're burned out, especially when we compare our lives to, the more challenging schedules of other residents, other specialties. It might be, hard to admit that we're struggling, but burnout's real in our field as well as others.
I agree with that, Libby. I think that, burnout may be less prevalent in dermatology, but it doesn't make any of those cases of burnout any less real. And so the fact that derm residents don't or can't experience burnout is a myth. They do, we do. It happens less often. And so as a result, just like a rare diagnosis, it's sometimes harder to spot than something that we see all the time.
Yeah, I agree with what y'all said. I do think that the low stress perception of dermatologists may counterintuitively or paradoxically make recognizing burnout within others and ourselves challenging. So I think it's important for residents and faculty to be aware that this occurs in such a high prevalence. Although challenges to recognizing burnout amongst dermatology residents exist, we hope that this podcast will help promote awareness of the struggles we all face as dermatology residents and provide tools to identify and combat it. Again, this is Dr. Julie Croley, joined by Drs. Libby Tracey and Dan Mazori. Thank you all for tuning into this resident takeover episode on resident burnout.
And that concludes this week's episode of Dermatology Weekly. To get past and future episodes of Dermatology Weekly, subscribe now on Apple Podcasts, Spotify, TuneIn, YouTube, or wherever you get your podcasts. I'm Terry Rudd.
For Dr. Vincent DeLeo, MD Edge editor Melissa Sears, and all of us here at MD Edge, I'm Elisabeth Mechcatie. Thanks for listening.